This is a CGSN podcast, and I'm Julien Hogan, a pediatric nephrologist at Emory University in Atlanta. I'm pleased to share with you the highlights from our study looking at glomerular filtration rate trajectories in children, with a focus on how these trajectories may differ by sex. Previous adult studies found that male sex is associated with a faster CKiD progression, even when comparing patients with the same underlying disease. This observation is strengthened by animal studies that suggest that estrogens may slow progression. Recent studies suggested that differences in CKiD progression may explain sex disparities in access to kidney replacement therapy and especially to transplantation in children, where females appear to have less access to preemptive kidney transplantation. This raised our interest in this issue with the hope that a better understanding of CKiD progression trajectories and their risk factors may improve timely preparation for kidney replacement therapy in children. We used data from the CKiD study that are publicly available from the NIDDK data repository and included 888 participants followed prospectively with annual eGFR assessments. We used latent class mix models to assess the different eGFR trajectories in glomerular and non-glomerular patients separately. We observed 4 distinct eGFR trajectories among participants with non-glomerular diseases and 2 distinct eGFR trajectories among participants with glomerular diseases. Most participants with non-glomerular diseases had a slow or moderate CKiD progression and only differed by their baseline eGFR. A small subgroup of participants, mostly younger males with obstructive uropathies and recurrent urinary tract infections, had a fast eGFR decline. However, the association between male sex and rapid absolute eGFR decline was attenuated after adjustment for age, baseline eGFR, and proteinuria. Among participants with glomerular diseases, a subgroup, mostly females with systemic immunologic diseases or crescentic glomerulonephritis, had a rapid absolute eGFR decline. We did not find differences in CKiD progression by pubertal status. Overall, CKiD progression in children seems to be mostly dependent on the underlying kidney disease that defines both the baseline eGFR and the absolute eGFR decline. Differences in CKiD progression trajectories do not explain previously reported sex disparities in access to transplantation in children, which require further investigations.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.